Hello, everyone. Welcome to today's webinar. Thank you all for joining us. We're excited to have you here. We're really looking forward to talk in depth today about flavored tobacco restrictions and to highlight the work being done by local leaders in Los Angeles. My name is Patterson, and I am one of the co-executive directors of CityHealth. Next slide, please. I'd love to share a little bit about who CityHealth is and how we work. We are funded by the De Beaumont Foundation and Kaiser Permanente, and we work to advance a set of tried and tested policy solutions that ensure all people in the United States have access to healthy choices and the opportunity to live full, healthy lives. Together with visionary leaders, we make sure all people have a safe place to live, a healthy mind and body, and a thriving environment. Next slide, please. Here's a list of the dozen policies that we work on in partnership with local leaders and subject matter experts. You will note that we work across a variety of domains, including housing, education, income and food security, the natural environment, environmental health, and tobacco control. Each year, CityHealth awards gold, silver, and bronze medals according to the strength and number of policies that cities have in place. Today, we will be focusing on one policy specifically, flavored tobacco restrictions. Speaking of medals, here's a description of the medal criteria that we use to assess cities' flavored tobacco policies. We work closely with our technical assistance providers, such as the Campaign for Tobacco-Free Kids, to develop and refine these criteria. Before I turn it over to my colleague at the campaign, let me just remind folks to submit their question via the chat. We will be watching and want to make sure that we can collect and answer those questions. And with that, I will turn it over to our partners at the campaign. Laura?
Hi, everyone. My name is Laura Bach. I'm the Director of Research at the Campaign for Tobacco-Free Kids. Thanks for having me here today. You can go to the next slide. Today, I'm going to be presenting key findings from our report that we co-issued with CityHealth, including research on the public health harms of flavored tobacco products, why cities should act now to restrict flavored tobacco product sales, and the benefits of these policies. And before I get started, I do want to point out this picture here is from the recent passage of the comprehensive flavored tobacco restriction in Los Angeles, which you'll hear more about later. Next slide. So in recent years, tobacco companies have significantly stepped up the introduction and marketing of flavored tobacco products, especially e-cigarettes, although the flavored share of the market has increased across all products. In 2017, researchers had identified over 15,000 available e-cigarette flavors, and today, menthol cigarettes comprise 37% of the market, which is the highest on record. And finally, flavored cigars comprise over half of the convenience store market. Next. This growing market isn't a coincidence. The tobacco industry knows that flavors mask the harshness of tobacco and nicotine, making these products more appealing to youth and new users. In fact, research shows that 8 out of 10 kids who have ever used a tobacco product started with a flavored product. Next. E-cigarettes have been the most popular tobacco product among youth since 2014. And in 2018, the FDA and the Surgeon General declared youth e-cigarette use an epidemic. While youth e-cigarette use has declined since its peak in 2019, when over a quarter of high school students used e-cigarettes, it remains a public health crisis. Today, over 2 million young people, including 11.3% of high schoolers, are still current e-cigarette users. I do want to point out that the decline you see in 2021 in part reflects a change to survey methodology, and may also reflect pandemic-related factors. We know that a lot of kids were not in school at the time and may not have had normal peer interactions and access to e-cigarettes. So school and public health officials are worried that with kids now back in school, there's a risk of resurgence in youth tobacco use, especially e-cigarette use. Next. We know that flavors like mango, mint, and cotton candy are driving this e-cigarette use epidemic among young people. 85% of youth e-cigarette users report that they use flavored products, and 7 out of 10 youth say they use e-cigarettes because they come in flavors I like. Next. Unfortunately, an increasing number of youth e-cigarette users are not just experimenting, but are using these products frequently and becoming rapidly and seriously addicted. This is because many e-cigarettes contain high doses of nicotine, for instance, as much as a pack of 20 cigarettes. As a result, the proportion of youth who are using e-cigarettes frequently has steadily increased over the past several years. In 2021, 43.6% of high school e-cigarette users reported using e-cigarettes on a frequent basis, which is defined as 20 or more days a month, and 27.6% reported daily use. Next. In response to the youth e-cigarette epidemic, the FDA implemented an enforcement policy in February 2020 that prohibited flavored pod or cartridge-based products, which is like Juul, except for tobacco and menthol flavors. However, this policy left thousands of youth appealing e-cigarettes on the market, including flavored disposable e-cigarettes like Puff Bar, which is the most popular brand among youth, flavored e-liquids that can be used in refillable devices, and menthol flavored pod products. As a result, we've seen that sales and youth use of these exempted products has skyrocketed. In 2021, over half of high school e-cigarette users reported using disposable e-cigarettes, and 30% of high school users of flavored e-cigarettes reported using menthol flavored products. Next. The FDA has also had the opportunity to clear the market of flavored e-cigarettes through its pre-market review process. Under a federal court order by September 9th, 2020, all e-cigarette manufacturers were required to submit a pre-market tobacco application, or PMTA, to the FDA in order to stay on the market. The FDA then faced a deadline of September 9th, 2021, a year later, to rule on these applications. And the FDA has issued marketing denial orders to over 1 million flavored e-cigarettes, but it's yet to issue decisions on a lot of the e-cigarette products that are most popular with kids. And as of about an hour ago, this slide is outdated. As you may have seen, the FDA recently issued an order to bring Juul off the market. Still, they are considering whether to authorize other menthol flavored products. And we've seen 40 companies challenge their marketing orders in court, and we can probably expect Juul to do the same. Finally, until recently, products containing synthetic nicotine were not regulated by the FDA as either tobacco products or drugs. As a result, a growing number of e-cigarettes switched to using synthetic nicotine, which is nicotine not derived from tobacco, but it is just as addictive and harmful to kids. Finally, in March 2022, Congress passed legislation requiring manufacturers of synthetic nicotine products to obtain FDA authorization to keep a product on the market. So while FDA now has regulatory authority over these products, in the past they have not acted quickly to enforce against non-compliant products. In summary, FDA's regulation of e-cigarettes has been plagued with loopholes and delays. We know that if not all flavored products are removed from the market, kids will just shift to the remaining products like we saw with disposables and menthol products. Cities can act much more quickly and nimbly than the FDA to protect youth by removing all flavored e-cigarettes from the market now. Next. Now turning to menthol cigarettes. Menthol is a chemical compound. It cools and numbs the throat, masking the harshness of tobacco smoke and making it easier for beginners, primarily young people, to experiment with cigarettes and ultimately become addicted. Young people who initiate using menthol cigarettes are more likely to become long-term daily smokers, and menthol cigarettes are also more difficult for users to quit. Next. The industry has used menthol cigarettes for decades to hook new users. It's the only flavored cigarette left on the market, so it's no surprise that menthol cigarettes are popular among young people. Half of youth who have ever smoked started with menthol cigarettes. Menthols have also been a favorite tobacco industry strategy for targeting Black Americans, Latinos, LGBTQ people, and other communities. Today, 85% of Black smokers use menthols compared to just 29% of white smokers. Next. This preference for menthol cigarettes among Black smokers isn't an accident, and it's not an inherent preference, but it's the result of decades of targeted advertising by the tobacco industry. Since the 1950s, the tobacco industry has targeted Black Americans with pervasive marketing of menthol cigarettes through sponsorship of community and music events, free sampling, magazine advertising, and retail promotions. Today, menthol cigarettes continue to be heavily advertised, widely available, and priced more cheaply in Black communities. As a result, we've seen that preference for menthol cigarettes has grown from less than 10% of Black smokers in the 1950s to 85% today. Next. Menthols are a major reason why Black Americans suffered unfairly and disproportionately from tobacco use. Menthols are more addictive and harder to quit, which magnifies the public health impact on Black communities. While many Black smokers report wanting to quit smoking, and Black smokers are more likely than white smokers to try to quit, they're less likely to succeed. As a result, tobacco use remains the #1 cause of preventable death in the Black community, claiming over 45,000 lives each year. Tobacco use is a major contributor to the 3 leading causes of death in the Black community: heart disease, cancer, and stroke. And Black Americans die from these conditions at far higher rates than other racial and ethnic groups. Next. Today, the tobacco industry is using the same strategies it used to hook generations of Black Americans on menthol cigarettes to target young people with marketing for inexpensive flavored cigars, which can be smoked like cigarettes and cause many of the same devastating health consequences. Black youth have the highest rates of cigar smoking compared to other races and ethnicities, and overall, cigars are about as popular as cigarettes among youth. Youth cigar use, especially small cigars and cigarillos like those pictured here, is driven by a wide variety of flavors like tropical twist, cherry dynamite, and chocolate. In fact, 3/4 of youth cigar smokers say they smoke cigars because they come in flavors I like. Next. As you may have heard, just this past April, the FDA issued proposed rules to ban menthol cigarettes and flavored cigars. This is historic and an important step forward, but it's the first step in a very lengthy rulemaking process. Until any FDA rule is implemented, cities should continue their growing efforts to end the sale of menthol cigarettes, flavored cigars, and other flavored tobacco products. It will take a great deal of time for the FDA to finalize and implement the necessary regulations to prohibit these products. And tobacco industry efforts to block or postpone FDA action could cause further delays. Just as with flavored e-cigarettes, cities can act more quickly to protect public health and stop tobacco companies from targeting kids, Black Americans, and other groups with menthol cigarettes and other flavored tobacco products. Next. Ending the sale of flavored tobacco products will reduce the appeal of tobacco to young people and prevent them from ever trying tobacco. These policies will also help users quit, which will improve health, save lives, and reduce the healthcare costs associated with tobacco, which currently total over $225 billion annually. These policies will help everyone live longer, healthier lives, especially those in communities that have been disproportionately targeted by flavored tobacco advertising. Next. To learn more, you can follow this QR code or go to the CityHealth website to download our report. And now I'm going to turn it over to my colleague, Annie Tegen, to talk more about the components of a comprehensive policy to restrict flavored tobacco products.
Great, thank you so much, Laura. That was a great summary. So my name is Annie Tegen. I'm Vice President of Advocacy for Campaign for Tobacco-Free Kids. As Laura stated, there are many critical reasons for passing, flavored tobacco restrictions and getting candy flavored tobacco products off the market. And Tobacco-Free Kids is very happy to support local, city governments and state governments in reaching that goal. So I've been asked today to talk a little bit about the policies themselves, potential roadblocks or issues to watch out for. And so I will do that the best I can, and then certainly welcome questions from you all as we go forward. So next slide. So flavored tobacco laws, as Laura mentioned, they're extremely, she didn't mention this part, but they are extremely popular with the public. She did, of course, mention all the critical reasons that we pass them and why we need to protect youth from the e-cigarette epidemic. So, they're supported by all major health organizations nationwide, and that support is growing. These policies reduce youth access, prevent addiction, and ultimately save lives. In fact, working with city governments across the country, I don't know of another policy that could be passed right now that could have such a positive impact and a life-saving impact as this type of policy. So we are really excited to be partners in this fight. Next slide. There are several things to watch out for when local cities and towns are pursuing local flavored tobacco regulations. They're the 4 Ps: places, products, penalties, and then the new one, PMTA, which is something that Laura alluded to, and we'll discuss in just a second. So this photo here is actually from one of our campaigns. It was in San Francisco, and it was back in 2018. And since then, there have been, I wanted to point out, there have been 350 cities nationwide that have passed local ordinances. And some of those, the ones that have passed most recently have been comprehensive and very, very strong. So we're really delighted about the progress and the direction that this is going. As you all know, local leads the way. So what local cities and towns do around this policy is going to affect what the state governments do, and ultimately federal government will follow suit. So next slide. So first we'll start with places. And it's important, oops, sorry, I've got a chat blocking my screen here, but we really want to make sure that there are critical considerations that we share with you today, because in each of these local ordinances, the language matters. It really does. And we've learned a lot. There are a lot of lessons learned over the past 5 years working on this issue. And what we have learned is that in order to have an effective law that's really going to protect youth, we need to make sure that it includes all locations. That includes no exemptions for adult only 21 and over retailers, no adult only section, sort of a store within a store situation, and no exemptions for hookah bars or cigar bars. A lot of times the industry will try to weave these exemptions into laws, and they become very large loopholes. In Oakland, for example, there was a situation where early on, Oakland was one of the first cities to pass a flavored tobacco restriction. And they did so, but they included an exemption for a store within a store. So you were able to walk into a mini mart, and there'd be a little adult only section that only adults were allowed to enter. As you might imagine, that did not work. And it was certainly abused. And then they actually went back and corrected their law later. So what we learned is that the best way to do this is to include, make sure that all locations are covered right from the start. We have sample language on that and are very happy to share that. So next slide. In addition to places, it's important to include all flavored products. This slide demonstrates, you can see some of the samples of products that are out there on the market. I have some in front of me as well that I can show you later, but basically, we have things like Malty McFlurry, Oreo flavored vape juice and others that are certainly not marketed to adults, they're marketed to children. It's important that we include all flavored products when we're talking about this, and that includes across the board, menthol cigarettes and Swisher Sweets that are flavored, and certainly very attractive to young people. So we want to make sure that all products are included in your language. Next slide. Another important feature in these ordinances is we need to pay some attention to penalties. No penalties should be levied on youth for purchase or use or possession. These laws are in place not to penalize youth, but to protect them. So we take that very seriously and want to make sure that no fines or penalties are levied on youth. And so we can help with that, ensuring that is in your language as well. Next slide. PMTA. So the industry is pretty active right now, as you might imagine, in trying to get local ordinances to exempt, to have special exemptions for pre-market tobacco applications. So what that means is e-cigarette companies, as Laura stated, were basically required by the FDA to submit an application to stay on the market. And if they haven't submitted an application, they need to come off the market. And so a lot of these e-cigarette companies, including Juul, would very much like to stay on the market in your local cities and towns. And so they have tried to get exemptions from flavored tobacco ordinances inserted that would allow them to continue to have their products sold. And that would include what they will say is, we'd like an exemption if we've just applied. We don't necessarily have an answer from the FDA yet, but we'd like to be exempt and be able to still sell our candy flavored products in your city if we've simply applied and not yet received an answer. So that is something that we want folks to watch out for, and certainly can help walk cities through it as they go forward. So next slide. So, I covered fairly quickly the critical considerations that the top considerations that we kind of warn folks about. Places, which should include all places, all products. There shouldn't be penalties on youth, nor should there be penalties on the store clerks themselves. The penalties should be levied on the store owners. And then there's the PMTA exemption that we've asked folks to watch out for because we've really seen the industry push that a lot. So I'm more than happy to answer questions. I know I saw some questions pop up. Laura and I are here and can answer. Let's see. For some reason, they're not showing up anymore for me. I did see them pop up though. Let me see, maybe they're just in the chat. Okay. Yeah, I think there was a question that was asked about the number of ordinances that have passed, and someone said they missed that number. So as of April, there were 345 ordinances across the country that have been passed at the local level. And there are a number of states as well that have passed a flavored tobacco ban. And we've seen since April, there have been a couple more added to the mix, namely, very importantly, the city of Los Angeles, which was the largest city in the country to end the sale of all flavored tobacco products, including menthol cigarettes. So that was a huge and historic victory, and one that the tobacco industry was certainly not pleased with, but we are so proud of our champion Councilmember Mitch for the work that he did in lifting up the community and working with the community to make sure that ordinance was passed. So we are grateful. So I know there was one more question I think we got on PMTA, and I don't know if maybe Laura, since you had that slide, if you're willing to answer that question.
Sure. So PMTA is the pre-market tobacco application, tobacco product application. One of those. It's what I described earlier, that any new tobacco product, including e-cigarettes, had to apply to the FDA to stay on the market. So PMTA is talking about that. And as Annie described, some of the e-cigarette industry is pushing for products that have applied to the FDA to be exempted from flavors restrictions, even though just applying doesn't really mean anything.
And there was one more question about how does the campaign recommend these local ordinances be enforced? How do they recommend local officials determine if a product is flavored? And this is a great question. Both of these questions are excellent. Normally they're enforced by the public health departments in the communities. We have sort of enforcement protocol that we can recommend, sort of best practices that we're happy to share with you. And then, but normally, people do follow these laws, and normally the distributors don't distribute anymore to that city, won't distribute the product if once a local ordinance has been passed. We also see that, we have not seen like a black market or anything like that in the communities, but the industry will try to push that. So you may hear that pushed, and we're happy to respond to that when we can. So we also have, obviously tobacco retail licensing is key and is essential in every community. So making sure that that is enforced and is a great way to keep these ordinances, keep educating the community about these ordinances and making sure that we're communicating with all retailers and that they're all licensed. We can get to the answers to more questions later on in the panel. It sounds like we're a little bit out of time, but I will send it back to Katrina.
Thank you so much, Annie, and good afternoon, everyone, and good morning to our attendees on the West Coast. My name is Katrina Forrest, and I am one of the co-executive directors of CityHealth. I am incredibly excited to kick off our panel discussion today, but first, I would like to thank both Laura and Annie for their presentations. To me, the data and evidence are clear that flavored tobacco restriction policies can be effective in reducing youth initiation and go a long way to address the long-standing racial and health disparities that exist due in large part, to the predatory marketing of big tobacco companies. So thank you both so much once again for your very detailed and informative presentations. You all have already heard from the wonderful Annie Tegen, the Vice President of Advocacy for the Campaign for Tobacco-Free Kids, and I'm excited that she will join this portion of the conversation. I am also thrilled to welcome and be joined by Councilmember Mitch O'Farrell of Los Angeles. Councilmember O'Farrell is a dedicated public servant. He is a longstanding community activist, and since 2013, he has served as the representative for District 13, which includes Atwater Village, Hollywood, St. Andrews Square, Little Armenia, just to name a few. He has also been such an extraordinary champion on this particular issue, and you heard Annie talk about this a bit in her remarks, but he spearheaded the effort to bring a comprehensive tobacco flavor policy to the city of Los Angeles about 3 years ago. And thanks to his tenacity, to his dedication, to his leadership, the city did pass this policy earlier this month, and it was recently signed by the mayor. And as you heard Annie say, it now makes Los Angeles the largest city in America to remove flavored tobacco products from its shelves. It is truly an incredible victory, and I'm so excited to dig into the factors and mechanics that led to this successful policy passage. Councilmember, I'm going to take a beat to see if you want to say anything to the audience before we dive right into the conversation.
Thank you so much. I'll just say this. First of all, thank you, Katrina, and thank you, Laura, and thank you, Annie. It's great to be with all of you today, and everyone who's tuning in, and everyone who helped and is helping to host this webinar. So I thank everyone affiliated with CityHealth and with Campaign for Tobacco-Free Kids. And I'm looking forward to this participating this morning. Thank you.
Fantastic. All right, I'm going to jump right into my first question. And Annie, it's actually for you. It's a newsworthy day. Today, just minutes, maybe an hour or so ago, the FDA did announce that it will ban the sale of Juul e-cigarettes in the United States. What is your reaction to this news? What does it mean for cities? And can you say more about why this action is significant?
Yeah, it's a great question. It is a newsworthy day. Juul single-handedly sort of prompted the youth e-cigarette epidemic. And they used the same old tactics that the tobacco industry used on combustible cigarettes to lure youth with their targeted marketing campaigns, luring in young people, communities of color. And so we've always been, right on the heels of Juul and certainly watching everything that they do. The FDA must ensure that Juul is, and all other flavored tobacco products, e-cigarette tobacco products, don't receive any of these marketing orders. As Laura has said, as we've discussed, as Councilmember O'Farrell knows well, these products are there to lure kids in, and the flavors are luring kids in. So this is definitely historic. I will say though that the FDA is not known for their speed. And so we can expect that this will be a lengthy process. Don't expect, despite the headlines that you may see today, we don't expect that Juul products will be ripped off store shelves anytime too soon. There will be legal challenges. There will be, appeals. So we would just ask folks to sit tight. And I think that's the most important take home, is that cities should not wait for the FDA. The FDA process could, of course, take years. And so that's why this webinar is extremely timely today.
I really appreciate that insight, Annie. And you said it earlier, local leads the way. And to your point, now is not the time for cities to sit idle. You have the power and authority to take action today, and we definitely want to encourage you all to do that. My next question is for you, Councilmember O'Farrell, and sincere congratulations once again. The ordinance that you sponsored passed unanimously, incredible victory. But you've sponsored similar restrictions in past years. And so I'm curious to hear from you, what was different about this year that resulted in the successful passage of your flavored tobacco restriction policy?
Thank you. I think it's because we laid the groundwork 8 years ago. And Annie, you're right. FDA does not move fast. They're 8 years behind what we did back in 2014. I was a new council member then, and I led the effort to simply regulate e-cigarettes the same way we do tobacco products. And it was a battle royale. And Juul, owned by Altria, formerly Philip Morris Company, took out radio ads, took out social media ads. They put so-called experts to debate me leading up to the council action back in 2014. And it was a real big floor fight that took place. And one of my colleagues tried to exempt workplaces in terms of regulating e-cigarettes like tobacco. In other words, allowing them in restaurants and nightclubs and wherever else, because they weren't regulated like tobacco. And so I knew just from my close relationships with local schools that middle schoolers and high schoolers were sneaking them in and actually vaping during classes. So the schools were having real struggles. And then when my colleague tried to exempt the workplace, he actually had other council members supporting that exemption. So it was a floor fight. We defeated that amendment to the ordinance. And then I believe it was a unanimous vote. It's been 8 years ago now, so I'm not sure if it was unanimous, but it was close to unanimous. So despite all of the ads by Philip Morris and all of the big tobacco companies, and despite some of the debates that I had, radio debates with some of the so-called, experts, we still did it. And so that was in 2014. And then just 4 years ago is when I first introduced this latest initiative that was approved, as you mentioned, directing the city attorney and the departments to propose strategies to address nicotine addiction and flavored tobacco among youth, and restrictions on the sale of flavored tobacco, etc. And how I made the argument that it shouldn't be viewed any different. So I'll just tell you where it all comes from. I grew up in Oklahoma. Mother side of the family, Native American, father side of the family, poor farmers. My mother and father, when they were teenagers, 12, 13, 14 years old, began smoking. I grew up in a smoke-filled, chain smoking household, and all my brother and both sisters and myself all have lung damage. And this was, 70s Oklahoma. I lost all 4 grandparents to smoking-related illness and lung cancers, both parents who died young, one sister now who died of lung complications. I have asthma, which is completely treated and good, but I have the lung capacity of someone in their 70s, and I'm 61. And I take really good care of myself. But this is the result of big tobacco marketing to Native American tribes. You go to any tribal town or any reservation. And one of the first stops is the smoke shop. And my grandfather would light the next cigarette with the one that was going out. So, and then they also marketed to poor farmers. And my father grew up on a farm. So it's insidious, it's generational, and they're still up to the same tactics, only they're more high tech. So for me, it was personal. So I could relate to these kids, I could relate to workers. And why should we exempt anything in the workplace when employees don't always have the luxury of simply finding another job somewhere else? So enough with all of this, and we've made the case, and we're able to accomplish this last month, as you mentioned. So this is just in the long line of never giving up, always taking the fight forward, and relying on science and data. In 2014, we knew that vapor from vaping contained carcinogens, dozens and dozens of carcinogens, at minimum trace amounts that harmed the lungs of people around someone who's vaping. So the science has been in for a long, long time, and we just have to let science and data guide us, along with the whole moral issue of shortening people's lives, especially young kids who don't even have the choice. So we have an obligation and a moral obligation to protect children and everyone else. And I will never, ever give up in this fight. And we'll see what we can do moving forward.
Councilmember, thank you for that. And thank you for sharing your personal story. I think it really does speak to, and you mentioned this, it is generational, but it also speaks to the devastation that has been wrought by the industry. There are a couple of things that you mentioned that I want to dig into a bit more. You mentioned that this effort has actually been a labor of 8 years. You've laid the groundwork, you've set those pieces in motion, but I'm curious, what specifically did you do to go about building community support? Because this is a policy that should be intuitive, as you mentioned about the science and data. I think the evidence is clear, and yet it's still divisive. And there are a lot of issues that folks rightly have reasons to be concerned about. So I'm curious about what your efforts were to build community support. And then there was another piece in there around the exemptions that I want to come back to you, Annie, on.
I think it leads with being passionate about an issue that either you understand professionally and intellectually or personally. And it's interesting. The psychology of building support for something is very interesting. Humans by nature are conflicted in their feelings. It's just by nature we are. We think critically, we challenge what we're told, or what we're led to believe. So my philosophy and approach to things has always been give people a chance to realize the truth and just keep at it. Don't beat anyone over the head over it, but always bring the fight. And I took on big tobacco in 2014, and I knew that I had right on my side, and I had allies everywhere, like you all. I mean, the groundwork and the advocacy was well in place. The American Cancer Society, all these groups had done all of this groundwork already. So I was in this privileged place to pull the lever and exhibit some courage and encourage my colleagues and others in city leadership to also exhibit some courage and shut this thing down once and for all. And that was the beginning of it. So I think it just takes passion. It takes marshaling the resources that already exist, that lobbyists and others try to keep you from, and sticking with what you know and what you're passionate about, and then letting the truth bear out. That's how I've always approached things. It took us forever to ban elephant bullhooks. But I led in that effort as well when I was a new council member. All the science was in then too. So that led to the shutdown of Barnum and Bailey Circus, and now they're reviving as a human-only circus. So when you know something is on your side, and the truth and the moral imperative is there, nothing should stop us from bringing the fight forward. And that doesn't mean with fists and accusations and name calling. It just means leading with the truth and never backing down, and working with allies that already set the groundwork. I didn't set the groundwork for any of this. I simply delivered what you all have been working at for decades.
Thank you so much. I really appreciate that. And persistence, it sounds like, is key, but also incremental progress and taking wins as you get them on the road to sustainable, long-term, comprehensive change. Related to that, you talked about initially, you were sort of working against some exemptions. And that made me think, for you, Annie, there are a number of cities that are going to run up against some challenges, and concessions have to be made, and cities are taking action, but because of these concessions, they are creating loopholes and sometimes exempting things like hookah lounges. What advice would you give to cities that have adopted one or more of these policies that include these partial bans or other exemptions?
One thing that we have learned, well, first, before I start, I just wanted to, I think Councilmember O'Farrell may be shortchanging himself and his leadership. We just have been so proud of his leadership along the way. And I've been so inspired by council members all across the country that have stood up to big tobacco and just said, no, not in my city, not my kids. And that's exactly what he did. So I just wanted to say thank you again to him for that. But in terms of the exemption, great question, practical question. As I mentioned before, these ordinances are the most effective when they are comprehensive. So when they include all products and all locations. And so, it's important to, in fact, just the other night I was talking to I have a teenage daughter and one of her friends, and I was asking, how do young people get a hold of these products? And they said, anywhere, you can go to vape shops. And I said, don't they, what is the process? Don't they card you at the door? Don't they? They're like, no, it's so easy. It's no problem. Fake ID. So the way that she so nonchalantly responded like that, it made me realize that what we've been telling the council members across the country is that if these products are for sale on any shelf in your community, youth will access them. We can try to strengthen youth access laws. We can do what we can there, but the bottom line is, if they are for sale, youth will get their hands on them. So it's extremely important to pass comprehensive policies that include all products and all locations. So earlier on, I think when several years ago, when the first few ordinances were being passed, there were some more exemptions than we're seeing now. But now it's very rare to see an ordinance pass with significant exemptions. So I think we're learning.
Which is incredibly exciting, the progress that we are making. There's a question in the chat that I'm going to get to and dovetail it with a question that I also have, because with any policy, there are always critics, right? And critics of flavored tobacco policies have suggested that banning flavors will result in youth, in particular, taking up smoking traditional cigarettes. They have also suggested that there could be the emergence of illicit markets. And there also could be widespread revenue losses for cities. Annie, for you, are these concerns something city leaders really need to be worried about? And how can they address these concerns? And then Councilmember O'Farrell, for you, were any of these concerns raised in the Los Angeles debates? And if so, how did you specifically work through them? And the dovetail piece, because I want to make sure I get this person's question, they asked specifically about the business arguments. How did you tackle the business arguments? So I know that was a lot, but Annie, I will start with you. Are these concerns something city leaders really need to be worried about, and how can they address them?
Yeah, great question. They certainly do come up in ordinance, battles across the country when we're working on this. And, these are arguments that are perpetuated by the industry. What we have found is that in terms of the black market issue, that is not borne out in any of our cities, that issue. But the tobacco industry, of course, would love us to think that it is a severe concern. And then, the issues that you raised about youth switching to combustible cigarettes, the data don't show that that's an issue either. Youth are really, the combustible cigarettes, have been declining among youth for many years, and it is because of the youth e-cigarette epidemic. We were almost done, and because of the youth e-cigarette epidemic, tobacco use has surged again. And so, I would point. I wish I could get Laura back on here, but she's the one that digs into the data and can tell us that that's really not the case. Youth are not likely to switch to combustible products. They like flavors. They like killer custard. They like Pancake Man Tutti Frutti. They like strawberry belts. All these things that I have on my desk here just to demonstrate who the marketing is really geared to. So I will leave it to Councilmember O'Farrell to talk about any specific issues that he faced in Los Angeles.
And that marketing is just so insidious. It's wicked. And it's unbelievable to me that anyone would support a company that tempts children to become addicted, knowing that it's going to shortchange their health. I don't get it. It's bizarre. So I think that the costs to health far outweigh the costs to the economy by banning flavored tobacco and regulating e-cigarettes. In other words, I think the costs are greater to health and how that affects the economy as well in local municipalities. And one of the factors to help us prove our argument was I brought in the County of Los Angeles Health Department. So the City of LA doesn't have its own health department, so we rely on the county for public health. So I brought in the executive director back in 2014 to help me make the case, who brought the data. And so again, it's just showing the truth, showing what the data tells us about the dangers of secondhand smoke, tobacco, vaping, you name it. So that helped strengthen the argument. Business losses. Selling and marketing e-cigarettes and vaping implements, which, by the way, all they are is nicotine delivery devices. That's really all they are. Very, very, very tiny fraction of sales overall in the economy. I talked to a lot of folks back in 2014 that had just opened vape shops and all that, and I said, look, we just have to do this. We didn't do it overnight. It built up. At the end of the day, though, we have to land on the side of protecting public health instead of protecting someone's bottom line and their profit margin when their entire business model relies on harming people. So at the end of the day, you have to make those decisions. And again, I think that the benefit of what we did far, far outweighs the costs to the economy and to the business sector.
I really appreciate those comments from both of you and Councilmember, especially hearing that you brought in the county health department. I think that is so critical, tying this back to health. The health departments do have the data, they understand these issues, and they really can help to strengthen our arguments, particularly as we are pushing against a very well-resourced and organized industry. I also love the insistence to lean on the data, because I do think there's quite a bit of misinformation out there. Related to that, though, another issue that has come up, and Annie, you touched on this some in your presentation, was around enforcement. And one of the arguments that we are hearing is that because menthol cigarettes in particular are used predominantly by Black communities, there would be an over-policing in those communities. How do you both respond to those arguments and questions, because I do think they inflame very well-founded and well-documented concerns. So how do you guys address those?
Great question. And I'd like to start by just saying that tobacco use takes 45,000 Black lives from us every single year. And so it's the #1 cause of death among Black Americans. And, I think it's not a question of, racial profiling. It's a question of really taking away Black lives. And for years, the tobacco industry has funded organizations and they've funded prominent spokespeople to perpetuate this, this story, this narrative that, this is going to increase, racial profiling. And those are significant concerns and concerns that we all need to pay attention to just as a country. I think the simply it really has not been the case that there's been a lot of direct we are especially concerned with police interactions with young adults and youth. So one of the things that we do in every one of these laws is to make sure that there aren't any possession, use, or penalties among youth. So that has helped us. And so we've ensured, like in the Los Angeles ordinance, we worked with Councilmember to ensure that there weren't penalties levied among youth. And so there would not be that reason to have an altercation with members of the police department. So I think, the fight to end the sale of menthol has really been led by our partners of the African American Tobacco Leadership Control Council for decades. For well over a decade, they've been asking for this. And we need to focus on the tobacco use among Black Americans. The vast majority of Black Americans want to quit who use tobacco. So we really see this as a huge positive. And I'd love to allow Councilmember O'Farrell to respond as well.
Yeah, the city is only regulating the sale, not the use. So if someone is seen, using flavored tobacco, they're not even going to be stopped. I also take very seriously the whole issue and claim and real life examples in the past of criminalizing various behaviors. We continue to take great pains in taking that as a serious issue and making all considerations to see that doesn't happen. So again, it's the state that regulates use. We're simply regulating the sale, and that's where it's at. I think that the claims are red herrings just to firm up an argument based on the very emotional and real concern about racial profiling and all of those things that that we've been reckoning with for years now. And I'll also say this, in the Native American community, Native Americans in the US have the poorest health outcomes of any other demographic group by far, the poorest of the poorest of the poorest. High incidences of diabetes, early death, infant mortality, and the heavy addiction to nicotine in the Native American community. So the arguments weigh heavily in our favor for simply passing laws that make the air easier to breathe and protect the vulnerable from the dangers of big tobacco. That's where it always lands for me. And I trust the way we have been implementing these laws in the city of LA, because it's taken an all-in approach with our city attorney's office, with advocates, with just the great care that my office has in this approach and the sensitivities and sensibilities. We trust ourselves. And so we just, continue bringing the argument forward and letting the truth and the data speak for itself. There's not one incident in all of our vast research where someone's been arrested for vaping or smoking a cigarette or whatever who's underage. It just doesn't happen. The fear, I get it. And we should always have that concern in mind in everything we do because it's real. But let's just continue looking at the facts.
I really appreciate both of those comments. And I will just say, I do think these tactics are explicitly racist because they are designed to scare and manipulate communities of color into working against their own interests to save their lives. And it is pernicious. So thank you both for speaking to that. I see we are almost at time, but I did want to fill in one last question. We have seen that with the ban on flavored e-cigarettes and vapes, the industry is constantly evolving their products to skirt regulations and restrictions. What can cities do to ensure they future-proof to the extent that that is even possible? How do they future-proof their policies to protect the health and well-being of their communities?
I'll take the first stab at this one. We have to stay vigilant, stay on guard for what these pernicious, it's a great word, ideas of big tobacco are, and continue the strong relationship with CityHealth and with all the other organizations that are involved in this call, and all the other advocacy groups, and just keep those relationships going, because we know that things are going to keep coming our way to disadvantage people for profit. We know that it'll just keep coming. So stay vigilant, stay ahead of the science, and just keep at it.
I couldn't have answered it better. I will say that Tobacco Free Kids is here to help. So any local cities and towns that are interested in moving forward, we certainly are more than happy in partnership with CityHealth to support that and try to find some avenues with language to future-proof these ordinances.
Thank you both. Thank you so much for your time for this rich discussion. We so appreciate the partnership with CTFK. So Annie and Laura, thanks again for joining today's webinar. And Councilmember O'Farrell, what a champion, what an incredible story. Thank you so much for your remarks today. We were so thrilled to have you. With that, I'm going to pass it back to my colleague, Catherine Patterson.
I just want to thank you all again, our speakers, for joining us today, for great personal stories about why this policy matters, but also more importantly, I also want to thank everybody who joined us today. And for those of you who asked great questions and added so much in the chat. Please connect with us on social media. Please download our latest report on flavored tobacco restrictions. We'd love to work with you and your city leaders to promote evidence-based policy in your homes. Please reach out to us directly if you have any questions or if there are technical assistance needs that you may have. We're happy to talk with you all about what we do and how we work with local community members. I think what we are most excited by, and the council member talked about this so beautifully, is continuing to work together to have healthy, equitable communities across our nation. So thank you all so much. Have a great rest of your day, and we will see you all soon. Have a great one.
Thank you so much, Tobacco Free Kids and CityHealth, for all your incredible advocacy.
Thanks so much. Have a great one.
Thank you.